Hi, this is Dr. Johnny Nelson. I'm an orthopedic surgeon, shoulder, elbow, and hand surgeon at the Bone and Joint Surgery Clinic in Raleigh, North Carolina. And I just wanted to make this video for patients, both patients that I've seen in the past and patients that I've taken care of and helped to feel better, but also patients that may not have ever come to see me before, patients who may be thinking of coming to see me or an orthopedic surgeon somewhere else. Maybe you have shoulder pain, you have a rotator cuff issue, and you're wandering around the internet, and hopefully this video is helpful for you. And basically what it is, a few frequently asked questions about rotator cuff tears, rotator cuff surgery, rotator cuff injuries. And the first question that I always get, there's 5 questions here. The first question is always, why me? Right? Why do I have a rotator cuff tear? Why am I having rotator cuff problems? And knowing what I know about the musculoskeletal system, we're always very reluctant to give you one exact cause, correct? So when things happen to us, especially problems with our bones and joints, it's almost always what we call multifactorial, meaning that it's a little bit of genetics, a little bit of medical issues, maybe some trauma, maybe degenerative, but usually it's multiple things that go into an injury or a physical condition. Now with the rotator cuff, I think it's most easy to break it down to one of 2 things, correct? So one is traumatic, right? So traumatic causes of rotator cuff issues are real, and they do happen. Injuries, falls, car accidents, such as higher energy things like car accidents can cause rotator cuff tears. Purely traumatic injuries to a rotator cuff, meaning that the rotator cuff was completely normal, completely pristine and strong, and all of a sudden it's completely pulled off of the bone. Those are actually very rare, but they do happen, they do exist. More common, we see patients that come in and have a traumatic injury, a fall, a strain injury where they're lifting something, or they're trying to catch an object and they strain the shoulder and they feel a pop and weakness. Most often those patients, while they do have a traumatic event, they have a discrete injury event in time where they can remember their shoulder was good and then all of a sudden it was not good. While those patients do have a discrete injury event, the vast majority of patients will have kind of an acute on chronic issue with their shoulder, meaning they had some mild, low level, possibly even silent and non-painful problems with the rotator cuff. And then they do something, they injure it, they fall, they overextend themselves, and they tip the scales in favor of having weakness and pain and problems with the shoulder, right? So that would be a traumatic with some element of what's called degenerative. And degenerative is that second part of things, right? So degenerative is more wear and tear. It is a lifetime of using the shoulder, of using the rotator cuff, of lifting, of pushing and pulling. In theory, overuse of certain things in our body can lead to degenerative changes. My theory and my way of thinking about rotator cuff tears and rotator cuff problems in particular is that the reason that we have problems and degenerative problems, meaning wear and tear problems with our rotator cuff, is secondary, meaning it's caused by other things going on in our shoulder, especially with the shoulder blades. Most of us do waist level activities for most of our lives, and most of us do waist level activities even for work. We don't do a lot of overhead lifting, pushing, and pulling. And because of that, our shoulder blades get very stiff, and they get very stiff in a bad position, so that when we do things at eye level, head level, and above, we start to have grating and wearing, tearing of the rotator cuff where the shoulder blade just doesn't move out of the way of the rotator cuffs. And over time, that leads to pinching in the shoulder, it leads to tendonitis, inflammation of the rotator cuff, and eventually tearing. And like I said, throw a little bit of trauma into the mix, and then you have a full rotator cuff tear. Now, what's important when you're thinking about rotator cuff problems, it's also important to realize that it's a spectrum of injury, right? It's not just I have a torn tendon and a non-torn tendon. It's true, you do have those extremes. On one end, you have the normal rotator cuff you're born with. It's nice, it's strong, it's thick, it's got good blood supply, it attaches to the bone, does everything it's supposed to do. On the other side, you have the completely torn rotator cuff, right? And I like to use the image of a rope made of a bunch of fibers. On the other side, you have the rope that's completely snapped and it's completely torn off of what it's connecting, correct? On the other side, you have the brand new rope. Now, in between this whole spectrum here, you have a whole spectrum of problems. So if the rope is made out of a bunch of fibers, over here on the more normal side, you have a few little those fibers kind of ping, ping, ping and pull off, but overall the rope is intact, right? And as you move along that spectrum, more and more of those fibers are diseased, more of those fibers are torn, and sometimes you've seen a really old rope, a whole full third of one of those twines, that the parts of the rope is snapped, but overall the rope is still functional and working, and that would be like a high-grade partial thickness rotator cuff tear. And then finally you have full failure of the rope. The rope just completely snaps, right? So keep in mind the rotator cuff is a spectrum of injury, and the reason that it happens is likely a combination of both. Usually there's a little bit of trauma in there, but the most common cause is what's called degenerative. The other final caveat I will say is that medical problems do make a difference. Things like diabetes, thyroid disease, there are medical issues that we have, and also bad habits like smoking that compromise the blood flow to our musculoskeletal system and our tissues. Those can certainly predispose us to weakening of the tissues, degeneration of the tissues, poor blood flow, and finally tearing. The second question that I often get is, well, how do I know that I have a rotator cuff tear, right? So to start with that, the only definitive, meaning foolproof, 100% sensitive and specific way of knowing, the gold standard is actually surgery, right? Is actually looking in the shoulder and looking at the rotator cuff with a camera. That is the gold standard. That not only shows us the rotator cuff, it shows us how torn it is, where it's torn, etc. Moving down the scale of reliability, you have MRIs, right? So MRIs are fantastic. They give us the most detail of the non-bony portions of the shoulder as possible. And those are very helpful to let us know if there is any sort of rotator cuff issue, tear, and also if it is torn, how many tendons are torn, and how much are they torn? Is it 50%? Is it 100%? If it is 100%, is it pulled off the bone? Is it retracted? Does it look repairable? How's the muscle? So MRI is certainly the next best step. And then there's ultrasound. So some orthopedic surgeons, including myself, are specially trained in in-office ultrasound that we use as a screening tool. I'm able to very quickly do an ultrasound evaluation. This is painless and it's very quick. And it's nice because you can see it right there, live action. It's almost like when you go for an ultrasound of a preborn baby, being able to see your shoulder and see the structures in your shoulder and whether or not they're torn. And that is something that I offer for my patient as a very good service. It's kind of between a physical exam and an MRI. Moving down the scale then, there are also other ways of knowing from your history and also from physical exam whether or not you have rotator cuff tearing. Now, I will say that those are a little bit less reliable, but certainly if a patient comes in to see me and they report an injury where they're doing some lifting and they felt a pop, and then since then they've had weakness and pain, especially when trying to move the arm away from their body in space, those patients suggest to me that they have a rotator cuff tear. And sometimes I go straight to ordering an MRI on those patients because the physical exam is so reliable. Some patients will even be completely unable to lift their arm, and if that's a new thing for them, then that certainly suggests that they have a rotator cuff tear. So that's how we know that patients have rotator cuff tears. The third question is, do I have to have rotator cuff surgery, right? So, okay, I have a rotator cuff tear. Do I have to have it repaired? That question is different for every patient, right? And that's why it's so important to visit with an orthopedic surgeon that you really trust, is because for different patients, this answer is a very complex decision to make. I always start by telling patients, listen, this is your rotator cuff, it's your shoulder. It's extremely important for you and for your livelihood and for your happiness and your quality of life. However, it's not your heart and it's not your lungs, and you can live with a rotator cuff tear. And it is possible, and a lot of patients walking around you in the same room that you're in right now watching this video probably have a rotator cuff tear and don't even know it. Now, that being said, we do know that patients with rotator cuff tears do not all fall into the same category, right? Some patients have very small tears, and we know that those patients with very small tears over time are less likely to get symptomatic and to start to have pain and weakness in their shoulder. And we know those small tears are less likely to progress and to become bigger tears. We also know that bigger tears tend to become symptomatic over time, so that if a patient is asymptomatic with a big tear, if you follow them, they're more likely to become symptomatic and have pain and weakness in their shoulder. We also know that the big tears are less likely over time to be repairable if you leave them alone. So if a patient comes to see me and they've got a full thickness rotator cuff tear that's pulled completely off of the bone, and we notice that either on an MRI and the ultrasound, I will have a frank discussion with them and say, listen, this is probably a new injury, a kind of a acute on chronic thing, and we have a window in which we can fix this and repair it. But after that, sometimes things scar down and the muscle quality is not as good, the tendon quality is not as good, and we can't get that repair. So we do know that the bigger tears do become irreparable over time. Finally, to make that decision, often we'll talk about the age and activity level of the patient, right? Somebody that comes to see me in their 30s, late 30s, early 40s, and they have a serious tear on their MRI or on their ultrasound, I will have a more serious conversation with them about doing an arthroscopic rotator cuff repair, mainly because they have so much life ahead of them, correct? So a patient with 40, 50, 60 years of life ahead of them that has a rotator cuff tear already, especially if it's full thickness, that's one that you're more likely going to want to fix, right? If a patient comes to see me and they're 80 or 85, correct? So not in any way to suggest those patients deserve anything less in terms of quality of life. The main thing that we're looking at there is functional needs. A patient in their 80s and their 90s are much less likely to do heavy lifting, pushing, pulling, arm away from the body. Now there's exceptions to that, but those patients are much more likely to be treated either without arthroscopic surgery, watchful waiting, injections, physical therapy, sometimes shoulder replacement, but less likely to go through an arthroscopic rotator cuff repair surgery. So to answer your question, no, you don't necessarily have to have rotator cuff repair surgery, but there are certain situations that in discussion with your orthopedic surgeon, doing your physical exam, taking your history, may kind of push things and tilt things towards or away from having surgery. Moving on, the next question I often get is, what is the surgery actually like? Like, what do I have to expect from rotator cuff repair surgery? Shoulder surgery itself is considerable. It's not as big as spine surgery or brain surgery. Usually I put it in the realm of hip or knee surgery, correct? So it's a big joint in the body, and because of that, it's not quite like it's not quite like a carpal tunnel release surgery. So it's not a small surgery, but it's also not a gigantic surgery. It is outpatient, meaning you're not going to be admitted to the hospital afterwards. Patients go home that same day. Typically, you will arrive at the surgery center of the hospital where the surgery is going to be performed. You'll be seen by multiple personnel, nurses, the anesthesia doctor, and a nerve block will typically be performed. And what that is basically a way of numbing the entire arm so you do not have any pain either during the procedure or after the procedure. Anesthesia usually is just sedation. People think, oh, I'm going to have surgery, I'm going to have a tube down my throat, I'm going to have a sore throat, I'm going to be under complete anesthesia, and I had all these problems last time. Typically, it's an IV in one arm, and they give you some medication and make you a little bit sleepy so that you're napping. No tube down the throat. I perform the procedure. Usually, depending on the degree of tearing, it can take anywhere from 1 hour to 3 hours. If for really bad multiple tendon tears and other things that we do during the surgery, often we will address the biceps tendon. We'll do other things like bone spurs and taking out the end of the clavicle. After that, you will come out of the operating room. You go to a recovery room. You'll have a big dressing on the outside of your shoulder that you take off after about 2 days. But you'll basically be in a sling, and you'll stay in that sling for almost 4 weeks. Now again, patients ask me, and that leads into the next question. What's the recovery time after rotator cuff repair surgery? So when you go home, basically the first 2 weeks for sure is just a cool down phase. Lots of icing, anti-inflammatories, around the clock Tylenol and ibuprofen, some stronger pain medicine if you need it. And basically that's a cool down phase. You're not really doing a lot of anything after that procedure, during this phase. You will be doing a little bit of hand, wrist, and elbow range of motion just to make sure you don't get too stiff and too swollen. I also have my patients come out of their sling to perform some gentle joint gliding exercises, usually starting around day 5 after the procedure. And then you'll come back and see me around 2 weeks after the procedure. In terms of when you can get back to activities, when PT starts, like I mentioned, everybody's a little bit different. Some patients don't even have a rotator cuff repair during the arthroscopic surgery. Those patients are typically in their sling, and they're a little bit more accelerated in terms of their rehab. So they're usually in their sling only for about 2 weeks as needed for comfort, and they can get back to using that arm right away. Again, it's a little bit slower, but in terms of gentle activities, they can usually come out and start doing around 2 weeks. Most of my patients that have a rotator cuff repair, what I tell them is they're going to be in the sling full time for 4 weeks. That is other than coming out for a shower, in which you hold your arm at your side and doing your hand, wrist, elbow range of motion exercises and joint gliding. You're in that sling for 4 weeks. At 4 weeks, I tell patients they can come out of their sling at home only. And I tell them, imagine drawing a little box here between their waist and about their eye level. In this area, you can do gentle waist level and hand-to-mouth activities. So eating, drinking, putting on your glasses, simple food prep at a counter, using a computer, no lifting, no pushing, no pulling, nothing out here, nothing over the head, nothing behind the back. So that's kind of the healing time. Still at that 4 weeks, you're going to be wearing your sling when you leave the house. And then at 6 weeks is when we start physical therapy. And by physical therapy, I mean going to see a physical therapist and really working to rebuild the range of motion and strengthen that shoulder after we're sure that the rotator cuff has healed. So that is what I have in terms of my frequently asked questions. If you have other questions, visit www.raleighupperx.com and submit a form with any information that you need from me, and I'll do my best to respond to those. Otherwise, you can call 919-872-5296 for an appointment, and look forward to seeing you around, and wish you the best.